folks, I'm Selima Harleston Lust, clinical herbalist and one of Herbal Academy's lead educators. In this part of our intensive, I'll be guiding you through herbs that can support some of the additional changes that come with the menopausal transition. Now let's turn to breast tenderness, another shift that many people notice in the menopausal transition. The most common form of breast pain is cyclical breast tenderness, which happens in about 2/3 of cases. It typically builds up in the weeks before your period and gets better once your period starts. This pattern happens because hormones affect different parts of your breast tissue in specific ways. Estrogen stimulates the milk ducts, progesterone affects the surrounding supportive tissue, and prolactin increases fluid production in the ducts. When these hormones work together, they cause tissues to hold more water, increase blood flow, and make nerve endings more sensitive, creating that familiar, tender, achy feeling on both sides, usually most noticeable in the outer and upper areas of the breasts. During perimenopause, ovulation becomes hit or miss, and hormone levels swing unpredictably. You might experience estrogen spikes without enough progesterone to balance them. Plus, stress can trigger extra prolactin release, so the breast tenderness becomes much less predictable, sometimes lasting longer than usual before your period or showing up even during cycles when you don't ovulate. On top of this, there's often poor drainage in the lymphatic system around the breast and armpit area when you're retaining fluid, which creates soreness that feels like fullness, heaviness, or sharp shooting pains, even as your overall breast tissue gradually becomes less dense with age. Menopause-related breast tenderness often shows up cyclically during perimenopause, especially when estrogen spikes without the balancing effect of progesterone. The tenderness may feel familiar, like premenstrual breast soreness, even when the cycles are irregular or absent. Other causes can include fibrocystic breast changes. These are often linked with caffeine or high dietary fats, certain medications like HRT or antidepressants, or thyroid imbalance. Persistent one-sided pain, discharge, or a new lump should always be evaluated further by a medical professional. Check in with your healthcare provider if you notice a new lump, thickened area, or skin dimpling, persistent pain in one breast only, nipple discharge, especially if it's bloody, a sudden change in breast size or shape. While tenderness itself is often benign and hormone related, it's always wise to rule out more serious conditions. When we work with herbs here, our goals are balancing hormone fluctuations, particularly supporting the relationship between estrogen and progesterone, easing inflammation and pain, supporting lymphatic circulation to reduce congestion and swelling, and nourishing tissues with phytoestrogens and essential fatty acids. Some key herbal actions include endocrine modulating, supporting healthy hormone balance, phytoestrogenic to buffer estrogen's shifts, inflammation lowering and analgesic to lessen pain and tenderness, and lymphatic alterative herbs to support fluid movement and breast tissue health. To start off our herb section, we're going to start with Vitex. When breast tenderness is linked to shifting hormones, especially the spikes and drops of estrogen without progesterone to balance it, Vitex has long been a trusted ally. Traditionally known as chasteberry, this small Mediterranean tree has been used for over 2,000 years to support menstrual rhythm, ease PMS, and soften breast pain. For those in perimenopause who notice familiar premenstrual soreness showing up unpredictably or lasting longer than usual, Vitex offers a way to restore balance at the pituitary level, where much of our hormone signaling begins. Vitex doesn't contain hormones itself. Instead, its constituents, especially iridoid glycosides and flavonoids, act indirectly by modulating pituitary function. It lowers excess prolactin through dopaminergic activity, which in turn supports healthier progesterone and estrogen balance. This prolactin lowering effect is one reason Vitex is especially helpful for cyclical mastalgia or breast tenderness and PMS type concerns. Modern clinical studies of standardized extracts confirm its ability to reduce breast pain and menstrual discomfort when used consistently over several months. Some key constituents include iridoid glycosides. These include agnoside, aucubin, which are pituitary modulating and prolactin lowering. We have flavonoids like casticin, apigenin, which are antioxidant and hormone modulating, and volatile oils and diterpenes, which contribute to overall endocrine effects. Energetically, Vitex is considered drying and slightly warming, making it well suited for patterns of congestion, tension, or damp fullness in breast tissue. Vitex can be taken in tincture, capsule, and standardized extract preparations used consistently to gradually restore hormonal signaling. For the dose, you can take a tincture of it, 2 to 5 milliliters, 3 times a day. Your tincture ratio will be 1 to 5 with a 60% alcohol. You can do a tea as well, 1 cup of 1 teaspoon dried berries and 8 fluid ounces, up to 3 times per day. Vitex is generally well tolerated. Use with caution with dopamine-related medications. Some of these are antipsychotics, maybe some Parkinson's drugs, IVF and hormone therapies, and in those with hormone-sensitive cancers without professional supervision. Vitex, black seed oil, evening primrose oil, and flaxseed each offer distinct pathways toward easing breast tenderness, from regulating hormone signaling to calming inflammation to supplying nourishing fatty acids. Together, they remind us that support can come through many doors and that plant allies provide gentle, accessible options for bringing balance back to tender breast tissue.